What if I told you that some of the biggest health problems adults face, we're talking everything from heart disease to depression, could actually have their roots in our childhood? Well, today, that's exactly what we're diving into. We're looking at some incredible research that connects the dots between our early years and how healthy we are for the rest of our lives. So let's just start with the big one, right? Does your childhood actually shape your destiny? It's a huge question, something I think we all wonder about. And as it turns out, science has some pretty clear and honestly pretty surprising answers. A huge part of that answer comes from one specific landmark study. This thing completely changed how we think about the long-term impact of stress during childhood. So let's get into it. Okay, so picture this. It's 1998, and two doctors, Vincent Folletti and Robert Anda, are conducting this massive study. It's called the Adverse Childhood Experiences Study, which is a mouthful, so everyone just calls it the ACEs study. And this wasn't some small thing. They worked with over 9,500 adults. That's a huge sample size, which means the results carry some serious scientific weight. So what exactly were they looking for? Well, they were studying these things they called adverse childhood experiences, or ACEs. Basically, ACEs are really stressful or even traumatic events that happen to you before you turn 18. And the whole point of the study was to see if these events could have a real, measurable impact on your health way, way down the line as an adult. All right, so you're probably wondering, what counts as an ACE? Well, the study came up with a pretty simple 10-question survey to figure that out. Let's walk through the kinds of things it covers. The first batch of questions deals with different kinds of abuse, and these can be tough to think about. It includes psychological or emotional abuse, being constantly sworn at, insulted, or put down. It covers physical abuse, being pushed, hit, or hurt. And it also asks about sexual abuse. Next up, the questionnaire looks at neglect. And this is a really important distinction, because it's not just about the bad things that happened to you, but also about the good things you didn't get. This means emotional neglect, that feeling of not being loved or supported by your family. And also physical neglect, like not having enough to eat or clean clothes or even basic medical care when you needed it. And then the last category digs into the environment you actually grew up in. Researchers call it household dysfunction, and it covers a lot. We're talking about things like your parents getting divorced, witnessing violence in your home, living with someone who had a substance abuse problem or someone with a serious mental illness. It even includes having a household member who went to prison. So here they are, all 10 questions laid out. They cover those three big areas we just talked about: abuse, neglect, and what's going on in the household. And the way you score it is super simple. For every question where you'd answer yes, you get 1 point. That final number, anywhere from 0 to 10, becomes your ACE score. Okay, so we have the questions, we have the scores. But this is where it gets really interesting. Because what the researchers did next was connect these ACE scores to the actual adult health records of all those participants. And frankly, the results were just staggering. Just take a look at this table from the original study. It shows you just how common these experiences really are. On the left, you've got the ACE scores from 0 up to 4 or more. And next to that is the percentage of people who had that score. You can just see how the numbers are all spread out. But the single biggest takeaway, the number that made everyone stop and pay attention, was this. Nearly 2/3 of the adults in this study, almost 64%, had at least one ACE. This was huge. It proved that this kind of childhood adversity wasn't some rare, fringe problem. It was incredibly common. But here's the real bombshell finding. The researchers discovered what they called a graded relationship. Now, in plain English, that just means the higher your ACE score, the higher your risk for a whole bunch of health problems later in life. It's like a dose-response relationship. The more ACEs, the greater the effect. Let me show you how that risk just stacks up. If you compare someone with an ACE score of 0 to someone with a score of 4 or more, the difference is just wow. The person with a score of 4 or more had a 4 to 12 times higher risk for things like alcoholism, drug abuse, and depression. And it didn't stop there. The risk was also higher for behaviors like smoking and even directly linked to physical health, with a much bigger chance of developing things like heart disease, cancer, and obesity. The connection was just undeniable. So all this data is incredibly powerful, but let's be honest, it can also feel a little scary or overwhelming. So let's bring this down to a much more personal level. The source material for this explainer comes from a retired clinical psychologist named Lane Lasater, and he actually shared his own story with this. He wrote, and this is a direct quote, "My adverse childhood experiences score was 6. This confirmed what I already knew. I started life as a very high-risk person." Hearing a professional in the field share his own score like that, it really makes it clear this isn't about shame or judgment. It's just about understanding the hand you were dealt. And you know what? That brings us to the most important point of this entire conversation. If this research tells us so much about risk, what does it say about our future? Is an ACE score a life sentence? And the answer is absolutely not.
Right after sharing his personal score, Lane Lasater follows it up with this incredibly powerful message of hope. He says, whatever your risk score is, please know that every action you take toward recovery counts. And that is the key right there. The score isn't your destiny. It's just information. It's a tool that can help explain the why behind some of our struggles and give us a starting point for healing. So at the end of the day, the ACEs study gives us a whole new way to look at our own lives, our health, and our stories. It teaches us that our past might be a roadmap that helps us understand how we got here, but it is absolutely not our final destination. The real power is in what we do with that information, in asking ourselves, what's my next step?